My name is Sarah Matthews, and I'm going to be demonstrating how lifestyle is affected by those diagnosed with Parkinson's disease. Parkinson's disease is a disorder that affects the central nervous system. It causes a tremor on one side of the body, but it can also occur on both sides. The tremor decreases mobility, and it causes you to have a short step gait. So the employer that I work for when at home, he's 50 years old, and he was diagnosed with Parkinson's disease a couple years ago. And working for him, I've been able to see firsthand all of his symptoms. And he does have a tremor in one hand. He doesn't have good balance, doesn't have very good coordination, and he does drag his feet when he walks. So his symptom severity isn't on the very severe end, but it is working its way up to being very severe. From speaking with my employer and listening through class discussions and having the interactions that I had with him, which was a phone call interview, I think that the most important pillar that he can change right now or improve on is exercise. So currently he only gets about 15 minutes a day of exercise, which is boxing in his living room for 15 minutes in the morning. This does not get his heart rate up as much as it needs to for him to be considered physically active. So exercise can really help my employer because it can treat his symptoms and also reduce the symptom severity that he is having. Not only through this class, I've also learned in other classes about exercise as medicine. I think exercise as medicine will really help my employer the most. So that's just the idea that exercise should be the primary component of care, especially if you're already on medications. You can pair that with exercise, and that will help. My employer currently does take medications, but it's the perfect example of a Band-Aid because he has to take it every 3 hours, and he no longer needs an alarm clock to know when his medications are needed because his tremor just goes very bad. So once his tremor starts getting bad, he knows it's time for medication. So he will never be symptom-free. He will only be symptom-free when he has medication. So exercise can really help him in his symptoms. So my suggestion for my employer is to be more physically active, maybe go on a walk in the morning, really get his heart rate up. Maybe start with a 15-minute walk in the morning and work his way up. To support my suggestion of improving my employer's physical activity to help the most with his symptoms, I found the Park and Shape trial, which included 130 patients that were diagnosed with Parkinson's disease. They were all randomly selected, and they were divided into one half would do aerobic interventions and the other half did stretching interventions. These exercises were all done 3 times per week for 30 to 45 minutes at their home, and it lasted for about 6 months. The results of this trial included that aerobic exercise helped with cognitive function and motor control, and it also increased function of corticostriatal sensorimotor functions and the connections between the two. And that is basically just the motivated behaviors towards sensory and motor pathways. And are there any questions about my demonstration?
I have one. I know you said that he should improve on his physical activity, but what other pillar do you think he should improve on?
The next pillar I think he would improve on is his nutrition, because I think right now he has a very poor nutrition, so in order for him to even think about being physically active, he has to fix his nutrition. Because I think right now he did say that he only eats a carb in the morning and then he eats dinner late at night, and he normally eats like Korean food or sushi, so that's not going to help him with his physical activity for the next day.